Hello and welcome to the Private Capital Podcast. I'm Joe Riley, head of Circulus Group, a network for family offices based in Greenwich, Connecticut. Today's guest is Jim Tananbaum of Foresite Capital. One of the most exciting places AI is revolutionizing right now is drug discovery. So I was very excited to have Jim on today. Jim Tananbaum is the founder and chief executive officer of Foresite Capital, a U.S.-focused healthcare investment firm founded in 2011 that has $3.5 billion in assets under management. During the last 3 decades, Jim has been a thought partner for some of the most impactful and fastest growth companies of their generation, including 10x Genomics, Amerigroup, and Jazz Pharmaceuticals. Jim's first success came while he was still at Harvard Business School when he co-founded GelTex Pharmaceuticals, which brought 2 drugs to market and was acquired in '99 for $1.4 billion. Jim was the founding chief executive of Theravance, a co-founder of Prospect Ventures, and a partner of Sierra Ventures. Jim studied engineering at Yale and earned an MD from Harvard Medical School, an MBA from Harvard Business School, and graduated from the Harvard MIT HST program. We discuss what it takes to start a drug company, breakthroughs in obesity, AI and the challenge of data in drug discovery, understanding the language of biology, advances in pain and cancer research, and his thoughts on brain implants. Please enjoy my conversation with Jim Tananbaum.
This podcast is for educational and entertainment purposes only. Anything said by the guests or host should not be construed as legal or investment advice. Thanks for listening.
So we just had your brother Steve, the founder of Golden Tree, speak at our fall summit. What was going on in your household growing up that had produced 2 exceptional investors?
My grandfather was an entrepreneur, and we have a number of family members that have been very entrepreneurial. And there was a big family business that our grandfather and some of his brothers and sisters were involved with. There were winners and losers, ultimately, in succession planning. Our father ended up not being part of the ongoing operations of the family business. And I think my brother and I probably saw that and said, we're not going to be dependent upon other people. We're going to work hard to be independent. And we both independently got into the money management world from the fund side, myself and venture capital, my brother and debt. And I think that our father and mother had a number of driving influences on us. Both parents really thought that we could do anything that we set our mind to. Our parents were incredibly encouraging of our basically just being aggressive and bold in terms of how we were thinking about what we wanted to do with our lives and pursuing our loves and interests. And when ultimately, I think both my brother and I from a very early age had a deep-seated belief that we could make it work on our own. And I think that came from our parents' belief in us. And I think that came from watching some of the struggles that they also went through.
You studied engineering undergrad. Tell us a little bit why you decided to go to medical school.
I was always interested in math, computer science, biology, and I'd always thought that bringing the 2 together would be something that would have impact on the world and would be an interesting place as an entrepreneur during my life. And I had this for a really early age, like back in high school. I was very far ahead in math when I was growing up. And while I was taking college and graduate level courses at Columbia and NYU's Courant Institute, there was a lot of applied math and computer science in biology and medicine. And it felt to me that if you just mapped out over time where this was going to go, that it was going to ultimately end up taking over medicine. And I went to college and ultimately found a number of faculty members at Yale that shared similar interests, and they were helpful in getting me to the Harvard and MIT community that also had a large number of people decades ago that really believed these areas could come together. And so I was lucky enough to go to good schools. I was lucky enough to have faculty take an interest in some of the things that I was interested in. And I was lucky enough also to have a mindset of thinking about having impact over a long period of time. And the way I think you have impact is by ushering in transformation. And when I was in school, I watched a number of faculty members actually create companies that were successful in the early days of biotech. And that ultimately made me decide that's the area that I want to focus my career.
Did you do a residency? Did you ever think about practicing medicine?
No, actually, I was a real outlier. So I went to medical school basically with the belief that I was going to use it for entrepreneurial activities. I got into the business school at Harvard very early, right after my first year of medical school, and then I deferred it for 3 years. And my medical school, one particular dean of the Harvard MIT HST program, thought I was making a mistake. He thought it would be better for me to focus on practicing medicine and using the business skills for the practice of medicine. And I thought that his background was a nephrologist, and I was interested. One of the products that we were interested in developing was a product for renal failure. And I was able to talk him into helping me found our first company. And so he started off by trying to talk me into leaving these entrepreneurial ideas behind, and I ended up talking him over to the dark side. So when I was in medical school, it wasn't really fashionable. In fact, it was a real outlier just to be thinking about business at all. And then over the course of the last 3 decades, it's now a very mainstream activity within Harvard Medical School. It's a very mainstream activity within the business school to be bringing these two things together.
You did a program at MIT, the Health and Technology program. What was the state of technology at that point? We had PCs, but this is pre-internet era.
Yeah, I was working on mainframe computers. Back in high school, I was doing computer modeling of blood flow around heart valves. At Yale, I was doing computer modeling of electrical brain activity from actual implants that were in people's brains that had very severe forms of epilepsy. And then at Harvard and MIT, I did a variety of different things, but I was interested more in how computers made their way into the practice of medicine. There was a center there called the Center for Clinical Computing, and I worked there for a number of years part-time while I was a medical student, and ultimately did a thesis on computers and the practice of medicine.
At the medical school, you got a master's at MIT, you got an MBA at Harvard, and you started a pharma company all in a short period of time. Do you have some production function you'd like to share with us?
I think that there's no greater positive reinforcement than having a dream and being able to enact the dream. And so one of the great things about the places I went to school was people were dreamers and they dreamed big, and they provided all the tools to make these dreams real. And I just found myself iterating and trying to design a business that I could build. Actually, the way that we started building GelTex was I first wanted to find other faculty members that had built businesses. So I listed a course in the Harvard MIT directories on entrepreneurship in healthcare, and recruited faculty members from both Harvard and MIT that had successfully formed companies. And then we ran a seminar and they spoke, and then a couple of those faculty members I actually recruited to help me think through how to form a company. And then I was pretty sure at the time I could raise $1 million for a biotech company. And so I had as a challenge to these people, let's figure out how to make a drug for less than $1 million. And one of the people I was talking with about this is George Whiteside Sr. His son, George Whiteside Jr., just got elected to the House of Representatives from California. He's a Democrat, just a few weeks ago. And George Whiteside Sr. was a Harvard Institute professor of chemistry, was a very famous chemist, had been involved in founding Genzyme and a number of other companies. And ultimately, we started working on a concept of making drugs that never got into your body as a way of making inexpensive drugs. And the idea basically is a drug's expensive when you eat it and it gets into your body and it does all sorts of things that you don't really realize it's doing. And so if you could make a drug that you eat and doesn't get into your body, then you don't have to worry about all the unanticipated side effects. And then the question becomes, what can you do with a drug that doesn't get into your body? And ultimately, we decided you could bind onto things. And we decided at the end of the day, when your kidneys are having problems, they can't bind phosphate. So if you could bind phosphate with a product that you ate and you pooped it out, that would be helpful for somebody that had kidney failure and couldn't concentrate phosphate. And that product we were able to develop for less than $1 million. The name of it's Renzella. The company GelTex was ultimately bought by Genzyme Sanofi. And it's still to date one of the largest volume renal products, but it came from a basic idea of trying to design something that could be brought to market relatively inexpensively by constraining effectively what we were trying to design.
So tell us a little bit about that. What did it take to start a drug company back then? What did you need to have business-wise on day one?
Everything you needed to have, I didn't have. And back then, the biotech successes were Genentech. And there were a whole series of other companies that were getting started, but they were big biotech companies, and they needed, frankly, billions of dollars to be successful. And so this idea of a inexpensive product that was uniquely developed so that it could be designed for a small amount of money, that just wasn't in the venture playbook at all. So we went around a half a dozen venture firms. Back then, the venture community was super small, and we went around a half a dozen venture firms, and they turned us all down. Ultimately, we were able to raise $1 million from entrepreneurs and CEOs in the Boston community that knew some of the scientists that were involved with me, including George Whitesides. And then once we were able to demonstrate that we can actually make a potential product out of it, then we were able to raise venture capital. But back then, it was really probably the only product that I can think of over the last 30 years that you could design that way. We got lucky in a sense. We found the one thing you could do that way. And then otherwise, venture capital and biotech is about transformation. And biotech transformation is generally very expensive. And so really you want to go into it with leading scientists, but also with a fairly focused game plan as to how you're going to spend the money, because it can go very quickly, especially when you're spending money on science.
What were you spending the money on?
With GelTex, we were just spending it all on product development. I did a second company with George Whitesides called Theravance, and that's split into two companies now, in Vivo and Theravance Biopharma. And there the idea was to basically couple drugs together. And the basic insight was that if biology has a lot of functions that are very closely located to each other, and if you couple drugs, you can take advantage of the proximity of one function to another function or one target to another target. And if you think about Velcro, in a sense, it takes advantage of the strings being close to each other when you put the Velcro down. And biology uses that principle all the time. And we started off looking and thinking about Velcro, and then realizing we really only need two strings in order to make something more than twice as strong. When you put two things together, you actually square their strength. And so we produced a whole series of drugs that were just consisted of putting two pieces together for products that had targets that were located near each other. And that was, again, a concept where it simplified some of the aspects of R&D, because you were using existing products that you knew worked in existing ways, but you were just designing them and building them in a different way. But then most of the biotech community has gone after novel targets, novel modalities. And when you develop a novel target, there's a lot of biological risk that comes along with that. And then there's cost of clinical trials and cost of the failures of clinical trials. The average cost to produce a drug now is quoted as $500 million to $1 billion per product. And if you can put a company together, a biotech company together for hundreds of millions of dollars, that are actually successful in producing a product that produces billions of dollars of revenue, then that's ultimately a good value proposition. And that's the way that I think most of the venture community looks at biotech.
What is a novel target?
Name a disease.
Cancer.
All right, so cancer and obesity. So with cancer, you're just going back in time to Genentech. Like, what did Genentech do that was really interesting with regards to cancer? This is decades ago. There was for people that have breast cancer, some people express a protein called HER2. Mm-hmm. And Genentech produced an antibody, Herceptin, that targets HER2 proteins that are just expressed on some breast cancers. They're HER2 positive breast cancers. So that would be an example of an antibody targeted product. That was decades ago. Today, there are molecular targeted products. There's a whole variety of different types of ways to target cancer cells, but oncology has moved from breast cancer to genetically defined forms of cancer. And each genetically defined form of cancer has a genetic product, which is the mutation that's driving the cancer. And the products are specifically designed for each one of those mutations. So cancer, for example, moved from breast cancer treatment to, hey, we're going to look for antibodies to hurt breast cancer, to we're going to sequence out the breast cancer and look for all the things that are different in that cell from your normal cells and develop products against each one of those specific mutations that occur, so that any given person ultimately that has cancer will end up having a specific therapy that addresses their mutation specifically. So that's where cancer is going. And we're halfway through that conversation. We have maybe a quarter of the drugs for the various mutations, or a fifth of the drugs for the various mutations that are out there. And cancer sequencing is just beginning to become inexpensive enough to be done broad scale for anybody that has cancer. So you can match the tumor to the therapeutic options.
So interestingly, you were working on an anti-obesity drug when GelTex was acquired. What was the state of the art in obesity work back in '97?
Wow. All right. So, but that's so the idea basically was to find fat and poop it out. And the problem is basically fatty poop is not pleasant poop. That's the biggest problem. That's problem number one. Problem number two is you got to bind a lot of fat in order to compete, with the fat that people eat to make them fat. Actually, fat obesity has been an area of interest for a long time, going all the way back to GelTex. And ultimately, we became very interested in GLP-1 when we first formed Foresite in 2010, 11. And we were very early to that conversation, and it's played out for us positively in some investments and not so positively in other investments. But I think that GLP-1, I think Elon Musk just put this on X, that there's nothing better than having that available to the U.S. population at very low cost. And I agree with that GLP-1 is one of the most profound products to hit the market in my lifetime. And that includes Ozempic, as well as Mounjaro, as well as some of the next generation products like the one that Amgen's developing. And that really works at stopping obesity at the cellular level rather than at the ingestion of food level, which is a lot harder.
And what were the breakthroughs that led to that? I'm sure there was a lot of dead ends along the way.
Yeah, the GLP-1, there were a series of peptides that were linked with obesity and type 2 diabetes. GLP-1 basically is an insulin sensitizer. When you take a GLP-1 product like Ozempic, it basically makes your cells more sensitive to insulin. And it turns out that as we age, generally for a third of the population or for some very significant portion of the population, we end up getting more and more resistant to insulin, which means every time we eat a sugar load, our body ends up over-secreting insulin, which makes us hungrier faster. And you go into the cycle where you're just eating a little bit more as you get older every year. And what GLP-1 does is it resets effectively the insulin sensitivity that our cells have. And it has an impact on satiety. It has an impact on energy. It has an impact on both how much you consume because you're satiated, but also how efficiently the body ends up using what you consume. And then it turns out that it touches all sorts of cells, not just your fat cells. It touches your liver cells. It touches your kidneys, nervous tissue. There's a number of cells that the better they regulate insulin, the healthier they get, the younger they get. So the product's actually been shown to extend life, which is a remarkable product. It's known as cardiovascular superior product, basically. So people with type 2 diabetes that take the product actually have less heart attacks. People that don't take the product, which is, you can count the drugs that help you live longer statistically on one hand. It's also been shown to clear out fat from the liver. Kidneys seem to do better over time with people that are on GLP-1, especially with type 2 diabetes that tends to hit the kidneys. So anyway, it's a product that does a lot more than just gets us looking good.
So maybe talk a little bit, because you have this interesting entrepreneurial career and then you moved into the venture seat. Maybe you can tell us what the difference is between scaling, say, a SaaS business versus a biotech firm.
So my entrepreneurial activities were really biotech, and my venture activities have been primarily biotech and healthcare. There's very little SaaS in what we do, though there's a little bit. But on the biotech side, it's about product development. It's about making products that have an impact on the world that are technically superior to what is state of the art of the time. And it's really hard to do that because the world's super competitive. And first, finding your way to world-class scientists that have insights that are different from what the world is doing. And then secondly, finding your way to product development people that have worked through the difference between taking an idea all the way to a product that can be used by a large number of people. There is a huge difference between the physics of tech venture capital and bio venture capital. And tech venture capital has sometimes the advantage of being less expensive than biotech company, although some of the AI companies that are being developed really do need massive amounts of data and compute access, which leads to biotech-like numbers in terms of the dollars that they need to raise just to do basic product development. But the difference on the outcome is when you produce a successful drug, if it's $1 billion product, it gets discounted back and it's a $5 billion outcome. If it's a several $billion product, it gets discounted back and it's a $15 billion outcome. But we're not seeing $500 billion outcomes in biotech. In the tech world, the cost of producing a successful tech company can often be a lot less than the cost of producing a successful biotech company. But then on the upside, a successful tech company, 10, 20, 30, $50 billion, there's really no upper end to how large these companies can be when they're ultimately successful. With biotech, is it a $1 billion product? Is it a several billion dollar product? There tends to be a fairly high upper limit to what the value of a biotech company can be. This will hopefully change over the course of my lifetime as biotech becomes more tech-like and the production of biotech products moves into the cloud and starts to move away from some of the physical production. That would enable a biotech company to then produce multiple products. And at the end of the day, if a biotech company was able to produce several billion dollar products, then it would be worth twice as much or some multiple of producing a single product. And most of the biotechs today just produce a single product when they get bought. So the idea of producing a platform that could scale product development would get to much larger outcomes ultimately for biotech companies if they were able to do that. And that's the hope over the next couple of decades, that tech and AI could potentially bring to biotech drug discovery.
Tell us about the founding of Foresite and the difference between Foresite Labs and the main fund.
When I founded Foresite 11, 12 years ago, I had thought that data and healthcare and bio research was going to come together. And this theme that I had been interested in for a lot of my life in terms of just making biotech research development more efficient was going to continue to accelerate. We invested in classic biotech products early on, but we also invested in the data infrastructure, the sequencing infrastructure that could make research in biotech more efficient. And so we got involved with a number of genomics companies, including 10x Genomics early on. And those areas actually produced companies that were every bit as large as the drug companies, and in some cases were larger while they were growing very rapidly. And then about 6 or 7 years ago, it occurred to me that the tech community and bio communities weren't really talking with each other, and that the tech communities that just felt like there was a much more efficient way of using the data tools that we were funding than the ways that they were getting used. And so we decided to create an incubation platform, Foresite Labs, that would help make it more efficient having tech and bio talk to each other. And there, I was fortunate enough to recruit Vic Bajaj, who was the Chief Science Officer of Grail, and then before that was the Chief Science Officer at Verily Sub, which was their healthcare sub. And Vic was also a co-founder of the Verily platform and was there also in their scientific advisory board, but their Chief Scientific Officer. So he had been involved with as many data and AI projects that were product development efforts in bio as just about anybody. And when you step back and look at Grail, for example, which is still playing itself out, that is using AI and sequencing to detect cancer in a person's blood by a simple blood test. And that's an astounding sort of product when you think about it. And that's a product that at a couple $100 a blood test will be used broadly for screening over time once they complete their human clinical work. But the point being that bringing that sequencing effort together with AI, that was no small feat to develop that product. And it was one of the largest scale research, biotech and tech research efforts ever pulled together. And the thought was that we could build a platform that enabled entrepreneurs to build Grail-like entities or other entities that combined tech and bio more efficiently. And that's been running now for a number of years. Portfolio companies that have come off of that have raised several $billion now in capital. This year, we had a very visible product company come off of it called Xaira, Xaira. And that was a company that was formed with David Baker, who shared the Nobel Prize this year in chemistry for AI and chemistry with DeepMind. And we started incubating that company with David a couple of years ago. We also shared the incubation with Arch, another venture firm that's excellent. And we started building the company within Foresite Labs. Foresite Labs has also built machinery to do biological learning, to do drug discovery work, as well as to do clinical development work. And all of those tools are being used by Xaira to think how drug discovery can be done in an age of biological data and AI. And like some of the other large AI builds, it required a lot of money because AI generally is about data scaling and compute scaling. and also required bringing together people like David Baker and Mark Tessier-Levine, who runs the company, who was the former chief science officer of Genentech and president of Stanford. And so it's a company that has now adequate amount of capital, best in class founders and management. And on all those pieces were assembled through Foresite Labs, working in concert with Arch. And Foresite Labs now has a series of other companies that fit that same kind of model, where we're working with world-class founders, scientists, entrepreneurs, bringing them together for large builds that require the data and the AI to come together, as well as the bio and the clinical.
How do you decide who ends up on that platform? How do you filter?
There's three types of builds that we do on the platform right now. One are the very big AI builds. And Azera is the first one that's come off of the platform. And we have a couple others that are in the pipeline. And there it takes us years to work through them properly. And we're working through them with people like David Baker, the world-class scientists, but recognizing that once ultimately they get hatched, they're going to require a remarkable amount of money in order to generate the data and do the learning. And these are very hard things to assemble. And those types of builds, these big AI builds, are once a year kinds of things, or they maybe will produce a couple in 1 year, but we've been working on them for 3 or 4 years in the background. So that's one type of build. Another machinery that Foresite Labs has built has been ingesting a whole set of data from around the world. And we're looking at methods for validating targets. These are areas where drugs are more likely to work because the human genetics and other factors validate effectively the mechanism of action of the product. And there we either buy products that fit into that model where we believe they're validated, or we build products that address an area of medicine that's unmet where there is nothing to buy. And then on the buying side, when you look globally at the best sources for products, China is a really interesting place. So we buy a lot of products from China right now at Foresite Labs, which are products that are validated by the Foresite Labs machinery and the Foresite Capital Therapeutics machinery. Foresite Capital's therapeutics team also has a very significant effort in China. We have members from the team that are spending significant time there, as well as boots on the ground there. But the basic thesis was about 5 years ago, China and a tremendous amount of private capital went into building China R&D for biotech. And that R&D is really good. And the basic thesis a few years ago was, hold on, with CFIUS and all of the trade issues, there's absolutely no way those molecules can get out of China. They can't list, there's no stock exchange for them to list on. You can't invest in them because of all the issues. So it just became clear to us that this is going to be a really great pipeline for potential assets to bring out of China. And we've done a couple flavors there. One flavor is we just buy the assets outright, and we're targeting assets that are validated by the machinery that we have within Foresite Labs and Foresite Capital's therapeutic team. And the other mechanism is we move the companies offshore to a Cayman Islands entity and invest in them. So the ones we can't buy, we move them offshore. And we just had a company that we recently did that with, that GSK bought one of its molecules the day after we actually moved it offshore. But the point is that China is a really excellent supplier of biotech R&D right now.
Is technology or the team more important to you?
Yeah, everything we do involves people that have done it before. And at the end of the day, this is really, venture capital is really about the people. However, we have incredible access at a venture firm because of the scale of the people that we have looking for assets and looking for opportunities. So what we're able to do is effectively marry entrepreneurs with opportunities, but also entrepreneurs come into us all day long with opportunities. We're 60, 70% of what we do is fund other entrepreneurs that have ideas, and that's what we're in business to do. We're in business to back great entrepreneurs. And the rest of what we do is to help introduce great entrepreneurs to things that we think are super interesting or that we're building. But it all really boils down to great entrepreneurs.
Help us understand what it's like up against the coalface with AI and drug discovery. I'm assuming we all have access to models. It's inexpensive if you're just doing inference. So what are you actually spending the time and the money on? Is it cleaning the data? Is it getting better data? Is it building better models? Or is it just paying for compute?
A lot of the AI drug discovery work that we're doing centers around production of data that allows us to learn the language of biology, in a sense. So large language models, OpenAI, depend upon effectively the corpus of the internet to collect its data. And it's an enormous amount of data. When you think about what the corpus of biological research data is, it's a very small subset of what's available to OpenAI. And so generating the right types of biological data for learning purposes is an area where the world is just starting to do it properly. And so that's where a lot of our focus has been. What are the right types of data to generate at scale? And then access to the compute and other things. So those are table stakes. You need to have the money so that you can access the compute once you have the data. And then also, at the end of the day, developing cycles that allow you to converge on products is very hard. And so one has to pay a lot of attention to, are we converging on products before you start scaling things? And what are the metrics that we use to know that we're actually moving towards a product before we start to accelerate the data production that we think is going to end up leading to a product? So right now, it is, I think, about the right data for learning purposes to be produced, but that's a very hard thing to do. And I think a lot of the challenges is knowing whether you're producing the right data, measuring whether you're producing the right data before you start scaling that data that you're producing.
You say you're trying to understand the language of biology, but which thread do you follow? In the old days, you would read the leading journals, you'd follow the top scientists, but there's still a qualitative aspect to it. Who's doing the best research?
We generally stick with specific problems and specific people. So if you take a look at David Baker as an example, he was working on nanobodies, which are small synthetic versions of antibodies that can be designed basically in a cloud. And they work as well as what you would design in a lab growing up antibodies. So there you have a problem in protein design that is defined, that involves a person that's spent decades becoming the world leader at that specific problem. And by the way, if we can make next generation antibodies in the cloud without having to build them up, without any constraint, by the way, you can make antibodies for all sorts of things that you can't do physically because they're constraints. For example, an antibody is by definition grown up to things that we view as foreign. So things that we view as not foreign are very hard to grow antibodies up against. But if you're developing synthetic antibodies, you're not effectively constrained by your body's evolutionary processes. So that would be an area where the product development possibilities are enormous. They span almost all of protein product development, but it's a very specific set of data and problems that you're trying to learn the biology of. And so that would represent something that we think is a worthy multi-billion-dollar AI effort to build out the machinery to learn how to make antibodies more efficiently.
And so then as a VC, after you've done that work, how do you quantify the risk and decide to move forward with a molecule?
You let the data tell you whether or not you have something that's world-class as compared with the best that's produced by anybody in a lab. And what we're interested in doing are producing basically superior products to the best of what's around. And insofar as there's a published literature, when products are being developed, you know exactly what is state of the art at that time based upon whatever has been published. And generally you're looking for something that's a real advance from that. And then I would say in the case of a company like Xera, our hope is that it will be able to do that in multiple different places over time because it has an advantage that people that are working in the lab just don't have. It has an advantage that people that don't have the data don't have. But to be fair, the flip side of that is that these methods have really not yet translated into very substantial advantages in drug development. Or said another way, if you were to look at X-ray crystallization, taking a protein and crystallizing it and trying to see where the binding pocket is of that protein, those techniques get developed and widely adopted by industry. And no one player has one advantage over the other player because they're all using the same tools. And then ultimately, the tool of X-ray crystallography just gets incorporated everywhere, and it just makes the drug development process a little more efficient, but there's not one company that's become very super efficient as a result of that. because they've cornered X-ray crystallography. Here, if this is successful, the moat is the biological data production plus the cost of setting all this up properly. So these are not the types of things that are going to be widely, once they start to work, people will buy them, replicate them over time. They will be more available, but for a period of time, there'll be a very small number of players that have some very distinct advantages to developing drugs in this class if they're shown to be a more efficient way of doing it. So that would be the first time in history of drug discovery that you've actually able to build a platform that does something that nobody else can do. And so that's the excitement.
One of the companies in your portfolio that's particularly interesting is Candid. Could you tell us a little bit about that? Why did you get interested in it?
So Candid is another example of a company that involves assets, validated targets, assets in China, really great entrepreneur, Ken Song. And Ken was banging around wanting to do something in the space that we were interested in. And we had one asset, and there was another group that had another asset, and now there's a third asset, and Ken has brought them all together. But it started off as a Foresite Labs enterprise for one of those assets. And a simple way of thinking about what Ken is trying to do for autoimmunity is he's working on a new class of molecules called T-cell engagers. And when your body basically has immunity or autoimmunity, it's your immune system that is not editing out self from the conversation and having an autoimmune reaction to yourself when it shouldn't be having an autoimmune reaction. And our body's constantly running into things that are pathogens and running into cancer cells that are being produced by our body, running into normal cells, and our body edits out the immune cells effectively that attack the normal cells and often is able to attack the cancer cells without attacking the normal cells. And so a lot of us, our immune systems are constantly fighting things that are being produced by our own body, and it has to distinguish between self and almost self. And for some people, they lose the ability to edit out those cells. So what T-cell engagers do is it helps basically the immune system in people that are out of whack and with their immune balance and they're attacking themselves. It helps their immune system re-edit, become more aware of the aberrant immune cells that it hasn't properly edited out before. So this is effectively a way of taking something off the shelf that effectively teaches your body to relearn something that it has innately forgotten to do. So it's a very cool concept, and it competes actually with cell editing and other methods to take cells out of bodies and edit them to try and put them back in to re-educate them on what to do. But this is naturally, you just give them this drug and it changes the balance effectively of how your body views the autoimmunity. So it's a very cool concept, and Ken has been acquiring the assets that effectively cover the entire landscape of being able to do that. And he has a complete repertoire of assets that cover that landscape, and now they're developing it. And if they're correct, it will have a really big impact on autoimmunity. And autoimmunity is one of the areas that has produced Humira and some of the largest drugs in history. So I think autoimmunity and T-cell engagers, very interesting area. I think pain is a very interesting area. And there's a whole new class of pain medicines that are coming. They're called NAV 1.8, and that's a sodium channel that's on peripheral pain fibers. And they're small molecules, they're drugs, oral products that actually stop the pain at your pain fiber. So they're as effective as opioids. They're non-opioids, non-addictive, non-sedating. They just stop the pain at the pain fiber. And the first company to develop this is a company called Vertex. They have a product coming to market early next year, and we think it's going to be a really profound implications for the world because, let's face it, if we had an alternative to opioids that were every bit as effective but didn't have any of the downsides of opioids, that product would be used all over the place, from acute surgeries to name your type of chronic pain. And 20% of the population has some form of pain, one way or another, a year, maybe more. We think that T-cell engagers, NAV 1.8, GLP-1 are examples of categories, killer therapeutics that basically hit an area that is responsible for a wide range of diseases. And that company that's successful in making a difference in the area will read on many different product opportunities. A surgery, post-surgical product, a cancer pain product, an osteoarthritis product. Those are the family of products that come out of a NaV1.8 inhibitor. We have a portfolio company called Latigo, which has a second generation version of that product. So we're very excited about that.
How did you find the opportunity in Latigo? How did you structure the investment, and what kind of a timeline do you have in general for investments like this?
In general, we love to track genetically validated targets. And a NaV1.8 target is something that's been genetically validated. There are people out there that have this mutation. It's a very small number of people, but they can't feel pain. And we love genetically validated mechanisms. Then we love mechanisms that have been validated by companies that are developing first generation products. Between the genetics of NaV1.8 and the Vertex demonstration that they could produce a small molecule that actually inhibits that target, effectively gets rid of pain, that says to us there's a whole new product category. That's a whole new area to look for competitors in. And ultimately, we found a competitor that was just entering into the clinic around the time that the Vertex product was demonstrating in the clinic that it was validated. So the combination of those things helped us become very comfortable with taking the bet on this novel class of pain therapeutics. Generally speaking, we like to have things validated a couple different ways independently, and those tend to increase the odds a couple fold in our world. And then once something's validated, then we have a significant team over in the therapeutics group that looks at all aspects of the product, from a manufacturability, from a drug-like properties point of view, from how expensive will it be to develop, are the right people involved, and so on. So there's a pretty steep funnel that happens after something is essentially validated by some of these other methods, and we'll end up maybe looking at 100 investments a year. Several dozen of them are validated, and maybe 1 out of 10 of the ones that are validated are things that we would ultimately end up thinking have the combination of the right people and the right competitive dynamic.
And how do you think about how much investment that's going to require to ultimately get it over the finish line and through phase 3?
They're very expensive endeavors, and most of the time we're financing to a next risk reduction point with a healthy margin. And that mindset has generally worked, with the exception of what happened over 22, 23, and 24, and in, I'd say, 9, 10, 11. And what happened in those time periods were you could have great advances in clinical data, but because of exogenous circumstances, the markets were greatly compressed. And what the market was paying for a phase 3 ready asset in a normal market, it would pay for an approved product, like in a very compressed market. And interest rates are one of the biggest single leading indicators for biotech performance. It's hard to believe that, but at the end of the day, since a biotech investment is such a long dated investment, interest rates have a profound impact on how they're valued. So in an environment where interest rates are zero and a company enters into the clinic and passes its phase 1 data, the market values that very highly. In a normal marketplace, they wait until phase 2. In a marketplace where interest rates are the highest that they've been in decades, they cut in a half or a third of the value. And now all of a sudden, what you would get rewarded for phase 2 data, you need to be rewarded for almost your second phase 3 study. So it changes the physics of investing dramatically. And it's not dissimilar for private equity that underwrote leverage buyouts to a certain interest rate band. And then all of a sudden you're 3 points above that interest rate band. And it's a very different underwriting conversation. So over the course of the last decade, we've generally underwritten towards getting involved with assets preclinically and that they would appreciate as they reduce risk clinically. In the last couple of years, we've generally underwritten towards having to take products farther, and therefore there are larger checks that end up getting written for clinical stage assets so that you can get out from under the uncertainty of how long interest rates are going to stay this high and produce a product that has produced enough value that it can get discounted back to a nice appreciation from where you've invested.
You mentioned you studied implants at Yale. Do you have any thoughts on things like Neuralink?
Yeah. So I do believe that they're going to be very important products over time. We're very early to Neuralink, and Neuralink's implanting electrodes, not very small electrodes, actually into the brain. And there are advantages of that, and there are some disadvantages of that. And I think the initial use case is going to be quadriplegics and other people that have had very extreme set of circumstances where the long-term impact of having an implant in your brain where your brain gets knocked around and whatever, and the electrodes pull out, yank around, are less, that the benefit to somebody is so great. That's where you're going to see it get used first. So I don't see this as being something for the general population for the very foreseeable future. And just to get this into the hands of quadriplegics on the market, my bet is it's several years away from now at best. So it's a very long cycle. And then the technology of brain, you interface with the brain, that's a very nascent technology. So again, the concept of that being widespread use, I think that there's a lot of inventing, a lot of technology that needs to be developed in order to get there.
Jim, this is the question I've been dying to ask you. You've been working in medicine and technology now since the 1980s. Can you tell me why I still have to fax things to my doctor?
Yeah, that's a good question. I hear that is actually dramatically dropping now. And it's funny, we were just looking at a company that does patient data retrieval for healthcare delivery. And a year ago or 2 years ago, there was more than 80% of the data that was faxed. And there's actually a couple of companies, one large company, that all they do is pull records, fax them, and unscan them. But because of law changes and a more broader scale implementation, my understanding is that the percent of faxing is actually dropping dramatically. And so at this company that had that 80%, my understanding is it dropped to 20%. Although we hadn't seen demonstration of that. But the point is that I think people in the field are now starting to say that a lot of the stuff is becoming a lot more liquid than it was. And I think that for sure, you're going to see your data being liquid long before you're going to see brain-machine interfaces common.
Jim Tananbaum, thank you for joining us and sharing your wonderful insights with us today.
Thank you for having me. It was a real pleasure, Joe.
Thanks for listening. If you enjoyed the podcast, please leave us a review on Apple Podcasts or share it with your friends. Thank you.